Hi guys, so we're going to be going over vaginal preparation today. This is indicated for patients who have been laboring with ruptured of membranes that are going back for a cesarean C-section. Obviously, before we get started, this will take place in the OR, not in your labor room, and after your Foley has been inserted. Before you actually start anything, you do want to verify that your patient does not have a iodine allergy or shellfish allergy, because this is an iodine-based preparation solution. If your patient does, then you do want to ask your provider if there's an alternative preparation they would like utilized. So now that you've confirmed allergies, we are back in the OR and that you have placed the Foley, you're going to go ahead and get started. So while their legs are bent open, you're going to keep them in that same position. You're going to go ahead and open up your vaginal prep tray. And then you'll go ahead and grab gloves. This does not have to be a sterile procedure. You can use regular gloves as well. So I'm just using sterile gloves in this case, but either or is fine. Okay, so you do have a couple of drapes here that you can use. So you can always put one underneath the patient's butt, just to help with any of like the pooling from the solution. It's kind of a little something there. You do have some gloves in here if you do need them. And then normally this is for a DNC prep tray. So that's why you have the sponges, you have the scrub, but those are things we will not be utilizing. So you go ahead and take out these sponges. Here's our scrub here. It's going to be this orange guy. This is what we will not be using. So you can set that aside as well. You have your 3 wands here. The best way to do it is obviously to make sure that the sticks are pointed in your direction, so they're just easier to grab for you. And then we have the iodine solution is what we will be using. So you can go ahead and open up this guy. Normally the easiest way is to pour it right over your sponges here. You want them as saturated as possible. Okay, and you can use your left hand as well to kind of spread the labia if you do need to. However, with our mannequin, I think we'll be just fine. So you'll go ahead and you'll insert your wand here. Actually, just kidding, we'll need a little hand. And you're gonna go ahead and swirl, and as you're coming out, you're gonna be swirling as well. You're gonna pull it out. Now this guy is done. You'll do this 3 times. Same thing, insert all the way, swirl out, come right out. And then one last time, insert, swirl as we come out. Like I said, this will be after your catheter insertion. You'll go ahead and do your vaginal prep, and then you'll continue with the other preoperative checklist items, and then you'll continue with your abdominal prep. But I think that concludes how to perform a vaginal preparation. If you have any questions, let me know.